Thank you, Mr. Chairman, and Minority Member Scott as well. Appreciate the opportunity to have questions which deal with, my first one deals with telehealth. And Purdue University Center for Regional Development has conducted numerous studies on the lack of rural broadband and social and economic benefits to Americans and what can be gained from increasing that access. And many of you as witnesses have mentioned those benefits here today. In the Wabash Valley Heartland Innovation Network, it's a 10-county area in my district that includes much of the area of about 97,500 people, and they don't have access to residential broadband. We have been interested in expanding the appropriations that would be involved in improving or funding distance learning and telemedicine, and to give better access to the equipment that would help do that. So, Dr. Hess, I would ask you if you would care to elaborate on the types of healthcare services that can be, in addition to what you work with now, that might be provided to a patient in his or her home. And I'm also looking at the kind of equipment that works best for that patient in order to receive that telehealth and telemedicine.
Yeah, so good question. So one of the biggest needs, one of the biggest needs is telepsychiatry, and telemental health is a huge need. Actually, if you look at requests that we get, it's often for telepsychiatry. So there's a big movement now to develop different platforms because that's a huge need. Some of that would be done in clinics. Some of it could potentially be done in patient homes. Most of the thing in patient homes would be more preventative care. You know, in medicine, we're not very good at preventative care. You know, we tend to be in a fee-for-service world where the more we do as physicians, we get paid. That's just how the reimbursement is set up. But we like to go to a world where, you know, we're rewarded and reimbursed for preventing disease, but we're not there yet. So, you know, a lot of this can be done, as I mentioned. It doesn't have to be, there's such a shortage of physicians now in many areas that a lot of this can be done with nurse practitioners. They tend to be very, very good at this, developing relationships. So you look at patients that have complex diseases, chronic diseases like diabetes and hypertension, and you focus on them, and a lot of that management can be done by nurses in the home or pharmacists to review their medication. The other big group is, 5%, we call them the super users, 5% of patients consume about 50% of the healthcare resources. You know, they go to emergency rooms, they get admitted a lot. And that would be a group to focus on, and there's been some movement now to focus on those patients. It can't all be done through telehealth. You do need boots on the ground. You need to touch people. You can't do everything by telehealth, but telehealth is a great adjunct, particularly in rural areas. The other thing is we can provide specialists tend not to be in rural areas, and telehealth is a great way to bring a specialist consultation, if not to a patient's home, to a community health clinic where they're going. So I think it's a combination. Most of the stuff in a patient home is monitoring for diseases you have. So you're monitoring the blood pressure. And, we're not very good at controlling blood pressure. And a lot of times it's because we put people on so many medications, they can't keep track of them. I can't take 3 pills a day. I forget. How can we expect our patients to take 10 pills a day? So that's best done by nurses, nurse practitioners, and pharmacists. Doctors, we're not too good at that, honestly. So is there any kind of equipment Well, there's a lot of vendors. Our company that we sold was mostly focused on more more in hospital based, but there's more and more units you can use at the home. They're much simpler. They're often, you want to do something with an iPad or a computer. There's more and more things you can do with an iPad now, but you need the broadband connectivity. And on an iPad or a tablet, I should say, you can put a lot of patient education because, we're not very good also at educating our patients. We tend to, rush through. We tell them we're going to get an echocardiogram. They don't know what that is. A lot of that information can be put on tablets that they could work with. So there's a number of systems. I don't want to go through all the commercial. There's a number of companies that do that. But I think if you have the connectivity, you can always find a vendor to help you with the technology. The connectivity and the human factors are more important than the technology. I mean, the technology is almost a commodity. There's many good vendors for it.
Thank you very much. And I see I'm out of time. I wish I had time to have every one of the witnesses. I got questions, but thank you, Mr. Chair. I yield back.